You may have heard about shingles as a painful skin condition that usually affects older adults. Still, what if I tell you that the shingles vaccine may do more than just prevent a rash? It may also change how fast your body ages from the inside. Recent studies, including a large 2025 study of over 1.2 million people, indicate that the shingles vaccine can lower the risk of cardiovascular disease, CVD, by approximately 23 to 26%. The protective effect, likely driven by reduced inflammation and vascular damage, lasts for up to 8 years, with significant benefits seen in reducing stroke, heart failure, and heart attack risks. This idea is now being explored in new research using real people and real long-term health data. Shingles happens when a virus called varicella-zoster wakes up again in the body. This is the same virus that causes chickenpox, and after many years, it can come back when the immune system becomes weaker at the old age. But this new research is not just about preventing shingles, it is about understanding how the vaccine may affect biological aging, which is different from the number of years you have lived. Biological aging means how old your body really behaves at a cellular level, not just your birthday age. And scientists now measure this using things like DNA methylation clocks, which look at small chemical changes in your DNA that happen over time. But these changes can speed up or slow down depending on lifestyle, disease, and even vaccinations. In this US population-based research, scientists looked at thousands of adults who received the shingles vaccine, and they compared them with people who did not receive the vaccine. But they did not just look at infection rates, they looked deeper into biological aging markers to see if there was any difference over time. The research included people mostly above the age of 50 years, because that is the group most commonly recommended to get the shingles vaccine, and the data came from well-known national health databases that track long-term outcomes. But what makes this research interesting is that it combines vaccination records with advanced aging measurements. When they analyzed the data, they found that people who received the shingles vaccine showed slower biological aging compared to those who did not get vaccinated. And this difference was not small, but measurable and consistent across different groups. One of the key findings was that vaccinated individuals had about 1.5 to 3 years lower biological age compared to their actual age, depending on the method used to measure aging. And this was seen even after adjusting for factors like smoking, body weight, and existing health conditions. But this suggests something beyond just general healthy behavior. In percentage terms, the reduction in biological aging rate was around 2% to 5% slower in vaccinated individuals, which may not sound huge at first, but over many years, this small slowing can make a meaningful difference in health and disease risk. Another interesting finding was that people who had the newer recombinant shingles vaccine showed slightly stronger benefits compared to those who had the older live vaccine. And this may be because the newer vaccine creates a stronger immune response, but both types still showed positive effects overall. While we are in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos. So the big question is, how can a vaccine affect aging? And the answer seems to be linked to the immune system, which plays a major role in how fast we age. But as we get older, the immune system becomes less efficient and more inflamed, a process often called inflammaging. Vaccines like the shingles vaccine help train and strengthen the immune system, and they may reduce chronic low-level inflammation in the body. But lower inflammation is strongly linked to slower aging and lower risk of diseases like heart disease and diabetes. The research also showed that vaccinated individuals had lower levels of certain inflammatory markers in their blood, and these markers are known to increase with age and contribute to damage in tissues. But reducing them may help protect organs over time. Another possible explanation is something called trained immunity, where the immune system becomes better at responding not just to one virus, but to many different threats after vaccination, and this improved response may help reduce long-term damage. The scientists also looked at epigenetic clocks, which are tools that estimate biological age based on DNA changes, and they found that vaccinated individuals had slower ticking clocks compared to unvaccinated ones. But this effect was seen across multiple types of clocks, which adds strength to the findings. In simple terms, their cells looked younger than expected for their age, and this difference remained even years after vaccination. But this suggests a lasting effect rather than a short-term change. Another important point is that the benefit was seen in both men and women and across different ethnic and socioeconomic groups, which means the effect is likely general and not limited to a specific population, but more research is still needed to confirm this in other countries. The research also controlled for healthy user bias, which means people who get vaccinated may already be more health conscious, and even after adjusting for this, the association between vaccination and slower aging remains significant. But this strengthens the reliability of the results. They also checked whether other vaccines showed similar effects, and while some benefits were seen with other adult vaccines, the shingles vaccine showed one of the strongest associations with slower biological aging. But this may be because of the strong immune activation it produces. Now it is important to understand that this research shows an association, not direct cause and effect, which means we cannot say the vaccine alone is the reason for slower aging, but the connection is strong enough to take seriously and explore further. From a practical point of view, shingles vaccination is already recommended for adults over 50 years, mainly to prevent painful nerve complications, and this new evidence adds another possible benefit. But it should not replace other healthy habits. Lifestyle factors like diet, exercise, sleep, and blood sugar control still play a major role in aging, especially for people with long-term conditions like diabetes. But adding vaccination may give an extra layer of protection. For example, chronic inflammation is higher in people with diabetes, and anything that reduces inflammation may help slow complications. But this is where the shingles vaccine may provide indirect support. The research also observed that vaccinated individuals had slightly lower rates of age-related diseases over time, including cardiovascular disease and cognitive decline. But these findings need further confirmation in future research. Another point worth noting is that the benefit appeared stronger in older age groups, especially those above 60 years, where immune decline is more noticeable. But this makes sense because the immune boost from vaccination may have a bigger impact in this group. The timing of vaccination also mattered. People who received the vaccine earlier in their 50s showed longer-lasting benefits compared to those who delayed. But this suggests earlier prevention may be better. When looking at numbers, the difference in aging markers was equivalent to reversing about 2 to 4 years of biological aging in some individuals, and even a 1-year delay in aging can reduce disease risk significantly. But this shows how powerful small changes can be over time. The safety profile of the shingles vaccine remains strong, with most side effects being mild, like soreness at the injection site or mild fever, and serious side effects are rare. But this makes it a practical option for many people. Another interesting observation was that people who had stronger immune responses to the vaccine also showed greater slowing of biological aging, which suggests that how well your body responds to the vaccine may influence the benefit. But this area needs more research. Scientists are now exploring whether other vaccines may have similar anti-aging effects, including flu and pneumonia vaccines. But the shingles vaccine currently shows one of the clearest signals. This research also opens a new way of thinking about aging, not just as a natural process, but something that can be influenced by immune health and preventive care. But this could change how we approach aging in the future. There is also growing interest in combining vaccination with other strategies like nutrition and supplements to slow aging. But it is important to rely on evidence-based approaches rather than trends. In the future, we may see vaccines being used not just to prevent infections, but also as tools to maintain long-term health and slow aging. But more large-scale research is needed before making strong recommendations. For now, the takeaway is simple. Shingles vaccination may offer more than just protection from a painful disease. It may also help your body stay younger at a cellular level. But this benefit adds to the already strong reasons to consider vaccination. If you are over 50 years old or have conditions that weaken your immune system, talking to your doctor about the shingles vaccine may be a good step. But especially if you are already thinking about healthy aging. This kind of research shows how different parts of health are connected. Immunity, inflammation, aging, and disease all work together in complex ways. But improving one area can positively affect the others. And while no single step can stop aging completely, combining small benefits like vaccination, good nutrition, regular movement, and proper medical care can make a meaningful difference over time. But consistency is what really matters. If you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos.